Armand, explain more about the accusations that Agnes Buzyn is now facing.
Well, Agnes Buzyn is the former health minister. She will be heard by the Court of Justice of the Republic tomorrow, so this Friday. That is the only court that can question government ministers. She'd previously been heard by a parliamentary inquiry into the government's handling of the crisis. And as you said, according to judicial sources, she could be placed under formal investigation for endangering the lives of others. But I stress that she has not been placed under investigation up until now. The controversy really centers around the mask fiasco and the fact that there were almost no masks in France when people realized the seriousness of the pandemic. There were no stocks of masks, and that is something that she has taken a lot of heat for. But I think even though, Mark, she's not the only senior official to have faced the Senate inquiry, and indeed the current health minister, Olivier Véran, I gather he may be asked to speak before the parliamentary inquiry in the next few months. But she is, to critics, emblematic of what went wrong. And it was one phrase that she said at the time which really did for her career politically. She said, the risk of importing cases from Wuhan is virtually zero. And that has come to really haunt everything that she's done since.
The risk of importing cases virtually zero. Well, the statistics, as they say, speak for themselves. And that's, I think, part of a current government campaign. On a wider note, Armand, how do people in France view the handling of the COVID-19 pandemic as a whole?
Well, the government clearly has had a credibility problem in this crisis response, Mark, because for so many months it was saying to the French public, okay, unfortunately, the latest measures we tried didn't work as well as we'd hoped, but if you just follow these new rules, things will start getting better. But then when people followed those new rules, things didn't really get better, or maybe they did for a while, and then they got worse again. So clearly, there was a very strong sense of weariness, a problem of credibility for the government. Now the situation is slightly different because vaccine coverage is pretty extensive in France, but there are still a lot of questions that people have, and unease still exists because people are wondering what happens if a new variant comes into Europe and into France which resists vaccines. What is the government's plan then? Is it back to confinements? Is it back to national lockdowns? Because there's no other that all the eggs were put into the vaccine basket, so to speak. Should there be more emphasis on treatments now? So there are still a lot of questions that I think that the French public has about how the government is going to deal with this pandemic in the coming months.
Armand, Georgia.